Hi, I'm Matthew Holt, and I am here at the Health 2.0 Fall Conference 2018. Really enjoying myself because I'm going to get to talk about the sign here. Robert Johnson Foundation ran 2 challenges with Health 2.0 Catalyst, and the first winner of the first challenge, which is about opiates, is Chris Pesh, who's here from SoberGrid. So Chris, tell me a bit about SoberGrid and what did you win?
Sure thing. So we're super excited. Thank you for having us here, and we were excited to win the $50,000 prize from the Robert Wood Johnson Foundation. SoberGrid is a mobile health app for connecting people in recovery or seeking recovery from drug and alcohol addiction for 24/7 support. So we built it really in response to the addiction epidemic facing the country right now. As many of you know, I mean, we're losing a generation to this. More Americans died from overdose last year than died during the entire course of the Vietnam War. So solutions are sorely needed, and that's why we built SoberGrid to just address challenges to recovering from addiction.
Great. So how do you feel? I don't know what a SoberGrid is. Tell me what it is and how does it work?
Sure. So we started when we launched in 2015 as a social recovery community to enable people to provide one another with 24/7 support. So think, Alcoholics Anonymous 2.0. But as we've grown, we've established really strong retention and engagement. We've built a community of over 135,000 members using the app. And as we've grown, we've added in evidence-based features, things like daily check-ins, contingency management, the ability to make recovery a part of someone's daily life. We've also added trained and certified peer recovery coaches to be able to deliver that enhanced level of support 24/7 when people need it. And with funding from the National Science Foundation and National Institute of Health, we've successfully developed predictive analytics to be able to identify when someone's approaching a higher level of risk for relapse so that we can intervene to try to prevent it.
So one of the questions one of the judges asked you yesterday was around the idea of, okay, well, this is an addiction thing. People go off on binges, they get lost, they drop off your app. So, we know that people drop off apps and communities all the time anyway. How do you deal with that?
So one of the things we were actually pleasantly surprised to find is that our retention and engagement metrics exceed established benchmarks for the space that we're in. So we would have thought that because relapse rates are high, in this population close to 90% of people will relapse, we would have thought we would have very low retention and engagement, but in fact that's not the case. And what we're seeing is even if individuals relapse, they're returning to the app. They're posting on the newsfeed, day one again, I slipped up, I messed up, but then they're getting that flood of support from the community to help pull them back into the fold, kind of reinforce their desire to achieve sobriety.
And tell me a bit more about the outcomes, both in terms of what sort of hard data you have, but also what people who use the app are telling you about.
Sure. So in terms of what people are telling us, we have a tremendous amount of anecdotal evidence from people telling us the support they received through the application and from others in the community kept them from relapsing. When we're talking about heroin, opiates, that's quite literally a matter of life and death. In addition to that anecdotal evidence, we have a study that's been conducted showing that with the peer coaching, we're able to increase treatment completion. So outpatient treatment completion is enhanced when coupled with the peer coaching. In addition to that, we're working with our addiction research partners to gather more concrete evidence, really highlighting the efficacy of what we're doing.
Fabulous. So talk a bit about the wider opiate crisis. Obviously, Robert Johnson Foundation and many others are very interested in this. You're seeing a tremendous amount of attention focused on it. Where do you think that the SoberGrid fits in the sort of panoply of treatments, apps, and solutions that are being offered?
So what we're seeing right now is, government stakeholders, are putting a lot of emphasis on expanding access to treatment, expanding resources, as they should be. And that's terrific and that's critical. But what happens after that? What happens after somebody is discharged from a treatment program or released from the ER after an overdose? We need to give people the tools that they need to manage this chronic condition. And so that's kind of where we see ourselves coming in and helping out, is to be a tool to help people manage their condition and live a happy, sober life free from drugs and alcohol.
So that's great. Tell me a bit about SoberGrid, the company, and the business model. Obviously, it's nice to get 50 grand, but that's which is the prize that you won. But what's your, and you mentioned NIH grants and other funding like that, but what's your long-term business plan?
So the goal is to keep the core of the application free to the end user, free and available to anyone who needs it for support. That said, we currently monetize by selling licenses for our peer recovery coaching to county mental health boards. We're currently working with a number of counties in the state of Ohio. We're looking to expand as a resource that county boards can provide to individuals for support. But where I think we're eventually headed is we'd like to access the payer market, because we've found that payers are really bearing the brunt of the financial costs associated with addiction.
Yeah, I've had people from both Cigna and Guyball and others already talking about this to me, so it's a fantastic feature. Okay, if we come back here in 3 to 5 years, what do you hope both the impact your product looks like and the impact of what you've been doing is?
So from a product standpoint, our goal is to be able to deliver the right level of care to the right person at the right time. And we're working in that direction with the predictive analytics that we've already successfully developed to be able to accurately identify when people are approaching a relapse. So the product will be delivering care along a continuum based on an individual's risk to improve outcomes and prevent relapse. And the impact that I hope we'll be having in 5 years is to make a dent and to improve overall population health outcomes, to lower relapse rates in populations for payers, and to really save lives.
Fantastic. I've been talking with Chris Pesch. He is the COO of SoberGrid, which won the $50,000 first prize in the Robert Wood Johnson Foundation Opioid Challenge run by Catalyst to Health 2.0. I'm Matthew Holt, Health 2.0, reporting out. Thanks.
Thanks, Matthew.